We're going to get started. Please take your seats. Okay, please take your seats. We're going to get started. Please take your seats.
Ladies and gentlemen, please take your seats as the program will begin momentarily.
Beat Alabama. They definitely will not. See, Alabama can lose the SEC championship and they'll still be in the final. Then you have to beat Alabama twice to win that championship. That ain't great odds either. Now, this lawsuit that Supreme Court.
Okay. Not so bad, 4:10 on the dot, so thank you for being punctual. There's a sequence, an intentional sequence to what we're doing this afternoon. We started with Dr. Slaoui and General Perna talking about the vaccine portfolio and distribution strategies at the highest level. Then we had Dr. Marks talk about how those vaccines will be evaluated and approved, and what you just heard is how those vaccines will be stored and shipped and delivered. So our next panel is really going to be about how the vaccines are going to be administered. And for that, we're going to turn to Brad Smith, who's another Operation Warp Speed board member, and he's going to lead a panel with Rick Gates from Walgreens and John Roberts from CVS Health. And these stores, or I should say the stores of these two pharmacy companies alone, will represent tens of thousands of outlets at which Americans will eventually be able to get vaccines. But part of what we really wanted to focus on today is another vital role that these two companies are going to play, and that is they will deploy mobile vaccination teams into every long-term care and assisted living facility in the country at the direction, as you heard early on, of the state and with the permission of the nursing home. And I think it's somewhere between 80 and 85% of our 15,000 long-term care facilities have already signed up to have either CVS or Walgreens perform this role. It's an absolute turnkey service. They'll have everything that's needed to vaccinate. They'll come back 21 days later or 28 days later, depending on which vaccine it is, and they'll record all of the appropriate information. So Brad Smith and panelists, why don't you come on out?
Well, thank you both for, you guys hear me okay? Oh, perfect. Well, thank you guys both for being here. We've had the pleasure of working together in a number of ways over the past 8 or 9 months, and you guys have been two incredible American companies. Everything from in March and April, just keeping your stores open so that people had a place to go and get basic goods, to everything you've done to ramp up testing, and now here talking about the vaccine that will hopefully over the next several months bring us to an end of the pandemic. So thank you for everything you guys have done. So this is Rick Gates, Senior Vice President for Pharmacy and Healthcare and the lead for the COVID-19 vaccine administration effort at Walgreens, and John Roberts, the EVP and Chief Operating Officer at CVS Health. So as Paul was mentioning, we've talked a lot today about how we're going to distribute the vaccines to the end sites. And this panel is really to talk about how, as General Perna said, we really get shots in arms. And we're going to specifically talk about two settings and dig in a little bit on both of them. The first is the long-term care setting, specifically nursing homes, assisted living facilities. And then we're also going to talk about the retail setting and what would it mean for the average American to get a shot, and what does that experience look like for them. So maybe we'll start with talking about the long-term care facilities. So earlier this week, the CDC, under Dr. Redfield's leadership, made a recommendation for prioritization of who should get the vaccine first. In that first tier are healthcare workers, but also long-term care residents. And I know that many of the states, as Paul was saying, have contracted with you all to reach out to their long-term care facilities and to help administer the vaccine. Maybe you guys could both start by talking a little bit about the investments you've made to be prepared for that, and then also just thinking about us who maybe have a family member in one of the nursing home facilities. What will that look like from an actual patient experience, family experience? But maybe, Rick, we can start with you.
Yeah, sure thing, and certainly thank you for having me here today. First of all, I am a pharmacist, 25 years now, so I live and breathe pharmacy each and every day, and I can tell you that pharmacist, pharmacy, and Walgreens is just proud to be here as part of this build out, really to support Americans as we really look to get past this next challenging phase that we're in right now. So we're really proud to be here. Secondly, I was a pharmacist in stores for over 8 years, and I can tell you pharmacy is embedded in the communities that we serve. So not only do we work in the communities, we actually serve in the communities and live in the communities as well. So it's really important that that's part of the nature that pharmacy really plays in that place as well. And immunizations are core to what we do. And so I think, General Perna, as you were saying, it's expertise that's there. I just want to assure everybody that immunizations and vaccinations are something that pharmacists have been doing for well over 10 years. You think back to H1N1 and where we really leaned forward as a profession to really start to serve that as well. And I had the pleasure of serving on the planning committee for H1N1 within Walgreens as well. So I think there's a lot of expertise here to really help, I think, ensure that we get shots in arms, I think, is what we're trying to get as well. And I think the other challenge you have is reaching the vulnerable and the underserved. So I think a lot of work has to be done, and I think we have a lot of work to do to make sure that we get to areas that are more rural, underserved, and vulnerable. And I think you can see that industry has really started to do that, even with testing that you mentioned before. 70% of our sites are in underserved areas. So I think just from a framework perspective, I think pharmacy is well placed to really step forward and really help in this process. So to your question, I think that if you look at when we get vaccinations from the states, and I think that's the first part of it, we are committed within a couple of days of getting into the first long-term care facilities and ensuring that we're starting to vaccinate Americans at that point in time. And it's really critical that we have speed of pace to really start the vaccine process, and it still will take upwards of 2 to 3 months to get full vaccinations across, and I'll talk a little bit about how we're setting up the different clinics as well within long-term care facilities. Up to this point, we're well over 30,000 long-term care facilities have chosen Walgreens at this point in time. And whether they're 1 block away from us or they're 50 miles away from us, we will absolutely hit every single long-term care facility that has chosen us, because I think it's imperative that we are supporting Americans that are asking to be vaccinated as well. And just from an expertise perspective, I also want to just give assurances that off-site clinics are core to what we do. Every year we do off-site clinics for flu and pneumonia and others, and over the last 5 years alone, Walgreens has done about 150,000 off-site clinics to really support the communities that we're in. So when you talk about the expertise and the comfort, if you will, this is really core to what we do. I have a couple of things here, and it really goes back to the importance of working in this great ecosystem. I think that Operation Warp Speed is kind of set up, but working with CDC, HHS, the states, even the pharma companies to really start to build out an end-to-end solution that's going to be comfortable for patients, and obviously something that we can ensure that our practitioners and pharmacists can support in a very efficient and effective way as well. So I'm not quite as cool as all the last ones I had up there, but I do have a couple things here. We have worked hard to build out an end-to-end process really for the consumer, which is going to be critical for how they look at really working with us. So from signing up for vaccine to administration to follow-up communication, as well as how we're going to set up follow-up the second dose, right, the booster dose, if you will. We have to ensure that Americans get both doses, and I think that sits not only on the states, the health departments, but obviously on pharmacy as well, to ensure consumers know when to schedule it, as well as that we're going to follow up and ensure they actually get it as well and get the proper information out there. So a lot of work has been done in investment here to ensure that it's a seamless experience for consumers as well, both in long-term care facilities as well as for the broader general public as well. But equally as important, you talked about distribution a little bit earlier. We have worked as well. I didn't bring mine with me today, but we have been working on hub locations for ultra cold storage. So this is most specifically for the Pfizer vaccine. It will require us to have about 800 to 1,000 hub locations that we will actually put the Pfizer vaccine to ensure safety of storage, and then ultimately transport out into our locations as well. So we are deploying this as well as dry ice as a core part of what we're doing. And then kind of the last mile here, it's not as cool, but it is something that once the doses are thawed, we have a safe and efficient way to get the last mile out to long-term care facilities, ensure that there's safety for our team members, safety for obviously the public, and we have appropriate storage for the vaccine vaccines as well. So a lot of work being done on the logistics of how we're going to get it there as well. Important that we kind of shared that with you. When it comes to long-term care facilities, though, we are actually working in coordination with them as well as the state. And what that looks like are a couple of things. Long-term care facilities are being scheduled for 2 to 3 clinics right now. So we want to make sure that we have them booked, we have the timing set, we know what vaccine is going to be there, and we know when the secondary shots are going to be received so we can assure that there's going to be the completion of that series as well. It's critical for the vaccine effectiveness that we're going to do that as well. Second thing is we've got to work with long-term care facilities for appropriate space. It's got to be clean and organized, enough space for social distancing. It's got to be safe and clean, obviously, the way that we need to, but we have to ensure safety for the team members, for obviously the general public, as well as the employees of the long-term care facilities as well. So a lot of work is being set up to really support the collaboration, if you will, with those long-term care facilities. I think just to sum it up, I'd say that, you know, COVID vaccine itself does present some challenges different than what we've seen before, but it's really not something we can't do. So we have dealt with frozen vaccines before. We have dealt obviously with off-site vaccines before. All these things we just have to actually say how are we going to support the nuances to it. So it's the cold storage. It's going to be obviously excessive off-sites, all stuff that we can do and will do. And I'll just leave you with this from a pharmacy perspective. And I'll still, I think the line that General Perna said, you know, this is what we do. Pharmacy does this each and every day. We do over 15 to 20 million flu vaccines every day, or every year, I should say, and you don't have fanfare about that, right? So just trust that we have the infrastructure, and we are here, and we will support this process going forward. So.
Thanks. And John, I know you said you've had tens of thousands of long-term care facilities reach out to you as well. Can you talk a little bit about your guys' preparation?
Yeah, sure. And I'll try not to be repetitive to what Rick said, but yeah, let me just start by saying how happy we are to be working with all the partners that you're seeing at the summit today to put an end to this pandemic. You know, it's really important that we get this country back to some sense of normalcy. And I also just want to recognize the 240,000 CVS Health employees that are very, very proud to be part of this effort. Maybe just start by saying CVS has a lot of experience in the long-term care space. So we're actually the largest pharmacy services provider to long-term care through our OmniCare pharmacy. This year alone, we've conducted 8,000 flu clinics at long-term care facilities, and we're actually supporting 1,400 long-term care facilities with regular COVID testing. So we've got a lot of experience, highly confident. We know this space very well. And you heard 15,000 long-term care facilities. That's really nursing homes. So the sickest of the sick of our seniors, the ones that need the most support. But there's a bunch of other senior facilities like assisted living facilities, group homes. And so the CDC did a great job of surveying all these facilities, and we had 44,000 facilities that selected CVS to give the vaccine, and that'll be based on the state's priorities. And we'll be putting 9,000 pharmacists, technicians, and nurses on the road that will actually go to the facilities to administer the vaccines. And we're ready to get going. So as soon as the vaccines hit, General Perna, we're ready to get going. And depending upon which vaccine gets administered, we'll be able to complete that cycle of 2 doses in 6 to 8 weeks. Pfizer is 3 weeks between dose 1 and 2, and Moderna is 4 weeks. So depending upon which vaccine, that'll determine the timeline. And we're going to be leveraging our existing technology platforms. So we do this today to coordinate, track, and report to both states and the federal government about all the vaccine activity that takes place. And then we have the capability to safely transport the vaccines from where we receive them, and you heard that on the last panel, to these facilities, maintain them at the proper temperature control per the manufacturer's requirements. So CVS is ready, and we're ready to take care of this most vulnerable part of our population.
Well, thanks for all the preparation you guys have done with the long-term care home. So let's think out to maybe February or March or maybe even April when the vaccine becomes available to the majority of Americans across the country. You know, many of them are used to going into your stores today. I think you've both committed to having the vast majority of your stores be prepared to vaccinate folks. Maybe, John, we could start with you and you could talk through a little bit the preparations that you're undertaking, but also more than anything, what would the experience be for the average American when they sign up and come into the store?
Well, listen, it's you know, it's something that I can't think is more important for this country. And we've got a lot of experience, you know, Rick, like you do at Walgreens, giving vaccinations. And for this flu season alone, as an example, we've given 16 million flu shots already this year, which is double what we did last year. So, you know, people listen to the CDC guidance to get their flu shot. And we think, you know, providing access to the COVID vaccine to where people live will be very important to ensuring everybody who wants the vaccine can get it. And so that's why we think community pharmacy is such a great place for consumers to get the vaccine. So in our 10,000 stores, and Walgreens has something similar, we're within 10 miles of 85% of the population. So we're in the communities. It'll be easy for people to get to our stores. And 60% of our stores are in areas that are more vulnerable to COVID as well. And you know, we're very well prepared to vaccinate the general public. We have an established infrastructure to do this. We are trusted in the community across the country. Pharmacists are probably the most trusted person in their community. We've got a lot of experience giving vaccinations, not only flu, but lots of other vaccines. And finally, you know, we have experience and are committed to addressing the health inequities with outreach, access, support, and education. I think that's going to be very, very critical. So let me talk a little bit about what we're already doing in COVID. I think, you know, we're doing a lot already. So CVS is currently doing 70% of all the COVID testing in retail sites across the country. We have 4,700 stores where people can go and get a COVID test today. We've also worked with states, and we have 14 community sites where we're doing COVID testing in underserved communities. And we've administered 8 million COVID tests so far. I think you heard the number from President Trump that there's been 200 million tests given. We've done 8 million of those. And we will have the capacity at retail to administer 25 million COVID vaccines each and every month across our almost 10,000 stores. And we have 50,000 trained immunizers at CVS, and they're ready to go. So I think, you know, this whole notion of educating people on the safety and efficacy of this vaccine, we believe is going to be critical. So we are building and have built plans to do this. So we have 4.5 million people that shop our stores each and every day. So we'll have material, educational material that they can pick up in their stores, or we can distribute through the drive-through. We're going to leverage our trusted healthcare colleagues to educate people in their community, in the thousands of communities across this country where they live and work. And we'll also be leveraging a lot of our existing communication channels. So think of our circulars, our .com site, cvs.com, our in-store radio, or even our IVR when people come. So we think education is going to be critical. And as we think about distributing the vaccine, we're going to build off our experience that we have with the annual flu vaccine. So we will distribute the vaccines allocated to us in the order of priority that's determined by the individual states. And we know the states are going to be using the CDC guidelines as their guide as they decide on their priorities. We have the ability to distribute both Pfizer and Moderna at retail. So think of Pfizer as being the ultra-frozen and Moderna as being frozen. And so let me maybe just start with Moderna. So all of our stores have freezers. Moderna just needs to be stored at the regular freezer temperature. Those freezers all have temperature monitors that we can monitor to make sure that the vaccines are kept at the appropriate temperature. And so stores will be allocated vaccines based on appointments that are made, and those vaccines will be shipped directly to the stores and put into the freezers. For Pfizer, we have to do something a little bit different. So we've identified 1,100 depot stores across the country. They'll receive the Pfizer shipper that you saw earlier. You can actually keep that vaccine in that shipper for up to 15 days by replenishing the dry ice. And then it can be kept at regular refrigerated temperature for another 5 days. So think of it as these 1,100 depots will get the Pfizer vaccine, and then they'll deliver it to 9 other local stores in a way that ensures that it's correct at the right temperature and supports the vaccinations that they have scheduled. We've also created a robust consumer experience. So, Brad, I'm finally getting to your question, to ensure it's easy to schedule a vaccination. So it's going to be very easy. A consumer will go onto our website. They'll pick a store that's convenient to them. They'll pick a date that works in their schedule, and then they'll pick a time. And so these vaccinations will be done by appointment. Now, when they make that first appointment, they're also going to make their second appointment, because getting the second dose we feel is critical, and it needs to be done within a certain time frame from when they get that first dose. So think of it as what you would do when you buy a round-trip airplane ticket. So once that appointment is made, reminders will be sent to the customer ahead of their scheduled appointments, both the first and the second. It'll either be emails or texts. In the case where somebody misses their appointment, we'll actually make a live call to them to try to get them back in to get that second dose. Patients will arrive at their CVS, and it'll be a similar experience to going into your pharmacy to get a flu shot. They'll come in at their scheduled time. They'll meet with the pharmacist or technician. They'll get their flu shot. They'll get a record card with the vaccination that they got. We'll also email them that record as well. Now, we also think that there may be patients that want to only get their second dose at CVS. So maybe they've gotten their first dose somewhere else, and for some reason they can't get back to wherever they received that first dose. So what do? We'll actually have them go to the website. We'll ask them which vaccine they received on their first dose. And only those stores that have that same vaccine will show up as options for them to choose. Now, we also know that there may be customers that don't remember what their first dose was. And so what we'll do in that case is we'll either call the provider that gave them that first dose, or we'll also have the ability to query state records and find out what that vaccine is. So, and then the last thing I would say is there's no cost to the consumer. So everyone that wants a vaccine should be able to get it, and we're ready to go at CVS. So we think we've made a very easy, seamless experience. There's not going to be lines because everyone will be by appointment. There's a lot of follow-up to ensure they get the second dose, up to and including a phone call if they miss that appointment. And we'll be able to do 25 million vaccines a month. So we're pretty excited about being part of the solution here, Brad.
That's really helpful, and I think it's great to hear about the creativity you guys have had around the Pfizer vaccine. I know one of our concerns was, will you be able to deploy the Pfizer vaccine in a retail setting? And I think when you see the innovation around the box and the storage combined with the innovation you're having around one store serving and supporting 9 others, that's really helpful to see.
Great.
Rick, what about on your side?
Yeah, again, I don't want to repeat a lot of what you did, but I think what John really emphasizes is the fact that pharmacy is really well placed, I think, to help with vaccinating America in the general population. So I think it's really exciting when you hear about, I think, all of the different things that, whether it's CVS or Walgreens or broadly across pharmacy, is going to be doing to really ensure that great experience, a comfort level for consumers, as well as an understanding of the safety profiles. I do want to emphasize the fact that making sure that Americans understand the safety profile and why it's important to get the vaccine is going to be a key part of what pharmacy must do when it comes to the general population. So there's a lot of education we should be doing, a lot of materials working with the CDC, with the manufacturers and others that we need to get out there and educate America. So I think that's a really important part of what we're doing as we build out the infrastructures that we can to really support, the throughput that may be necessary for all of America. The only other thing I'd really emphasize here is that if you look at it, we've got to continue to improve the experience and make sure people feel comfortable with it, because even with the great numbers that we've had with the flu vaccine over the last couple of years, even between the companies like ours, there's a ton of Americans that aren't getting vaccines that should be getting vaccines. And so we've got, it's on us really to make sure that we make a safe environment. They understand the cleanliness protocols, that we have private health rooms, that there are areas that are going to be safe, and it is a professional that's doing this for them and helping them make sure that they get the subsequent dose as well. So there's a lot of education, I think, is going to be a part of what we have to do in the general population. I think that's core to what pharmacy can absolutely support. And then all the ancillaries, making it easy, making it digital, all those pieces I think will just make it easier and simpler for consumers, that they will actually want to navigate to pharmacy to really help solve that and or help get into a primary care provider, whoever it's going to be, to ensure they get vaccinated as well.
That's really helpful. I know, John, you already hit on this a little bit, and Rick, you mentioned it too, but I just think it's so important. Talk a little bit more about, these are the first two vaccines are 2-dose vaccines, and obviously it's really important that folks who get the first dose get the second dose from the same company. I know, John, you already spoke to this a little bit, but Rick, maybe add a little bit more color around that.
Yeah, getting the second dose is obviously it's not going to work. You won't have the effectiveness. You won't have the immunity that's necessary based off of just getting one dose. So getting the second dose is absolutely critical. So if you think about it, dose series completions are not new things that pharmacy have not done before, right? We have shingles vaccinations that require a subsequent dose. We have some pneumonia-based vaccinations where you have to get them yearly with a different type of dose. We have already processes in place to ensure that we get the second dose. And so I think that it goes back to there's expertise here. This is what we do every day, right? And vaccinations and getting second doses is core to what we do. We just have to continue to make it easier. So there's going to be a lot of work being done to make sure that we're communicating to the consumer the way that they want us to communicate to them. Is it texting? Is it a phone call? Do we want to send them a letter? It doesn't matter. We just need to make sure that they understand when their next dose is. It's automatically scheduled. And then at that point in time, follow-up calls or whatever it's going to take are necessary to get there. We are working in tandem, and I know John said it as well, with state registries and obviously with the federal registry. I know that the General Perna talked about. We've got to make sure that the data sharing is there so that we know who's gotten the vaccine, what vaccine they've received, and we can ensure that they get the second dose. And I think all of this is going to work together to help us ensure that we get to that point as well.
And Brad, the only thing I would add is, as part of registering on our digital site for the first dose, we'll get their cell phone numbers. I mean, just about everybody has a cell phone. And we find that texting is very effective at getting people, either in to refill their medication. We think it's going to be very effective at getting people for their second dose. And so we're really leveraging our technology communication platform to ensure people, come in and get that second dose. I think the first dose helps, but our clinical people say that, you're not going to be totally protected unless you get that second dose.
Well, I just want to conclude by saying, again, thank you guys for everything that you're doing. When the doses arrive, you guys will become the front lines, and you guys are both incredibly well prepared, and the country and all of us are very grateful. So thank you.
Thank you.
Okay.
Okay, our last panel before the Vice President sums things up. Let's thank these gentlemen, though, from CVS and Walgreens. As we said, two other incredibly trusted brands that will play such a key role in vaccinating our fellow citizens. So we're just so privileged to have them as part of this. So our final panel of the afternoon, and Secretary Azar is going to actually moderate it. And I think we said a little bit earlier, he's actually the architect of Operation Warp Speed. And you heard Dr. Slaoui talk about some of the key success factors from a scientific standpoint and the technology platforms. But If you look at Operation Warp Speed, it's also an enterprise. If you think about that, it's a business enterprise. So we were sitting in the Secretary's office one day in March, and we learned of a contract. Dr. Kadlik and others were beginning to engage in contracts to get vaccine development going. And after we learned about that contract, he asked the question, well, when are they going to start phase 1 trials? And having come from the pharmaceutical industry, he knew that was kind of a critical start to the whole development of a drug or a biologic in this case. And the answer was September. And that was completely unsatisfactory to the Secretary at the time. And he said, we just can't have business as usual at this point. So he understood 3 aspects that had to change right away. One, we needed different talent. He picked up the phone, some of his industry contacts. I was in his office, and he said, who's the best vaccine developer in the world? We got one answer, Moncef Slaoui. Who's the best manufacturing executive in the world? Carlo Di Natale Stefani. Both of them are core members of the team. Next day, he picks up the phone, calls Secretary Esper. I need a logistics expert. That's how we got General Perna. So it was about talent, just getting the team together that would actually do this. Second, he understood, you heard Moncef talk about manufacturing at risk. Having come from the pharmaceutical industry, he knew there weren't going to be many pharmaceutical companies that were going to manufacture 100 million doses before they understood whether they're going to get an EUA or a licensure from the FDA. So that was a big part of the design. And then lastly, we haven't talked about it today, but governance. How do we cut through the bureaucracy? How did Operation Warp Speed cut through the bureaucracy? It was very simple. A direct report from the board of Operation Warp Speed to the President of the United States as the sponsor, the President as the sponsor of this overall effort. So when we say the architect of Operation Warp Speed, those were 3 key success factors. That's why we are where we are today. We talked a little bit earlier about 3 partnerships. We're going to now engage in that last one, which is federal-state. And this is consistent with the principles we've used all along: federally supported, state-managed, locally executed. And I looked at the attendee list before we arrived today, and I'm pleased to see that there's several county commissioners and actually mayors in the audience. And they're the ones who are actually going to have to, at the end of the day, execute. So thank you for making your way here to D.C. All 64 states and jurisdictions actually have submitted detailed vaccination plans to the CDC. Those plans were evaluated, and amongst the best 4 that were evaluated were those from Louisiana, Texas, Florida, and Tennessee. And we're fortunate to have the governors from those states with us this afternoon. Governor John Bel Edwards from Louisiana, Governor Greg Abbott from Texas, Governor Ron DeSantis from Florida, and Governor Bill Lee from Tennessee. So Secretary Azar and the governors, come on out.
Well, Paul, thank you very much for that introduction of the governors here and for some of that history on how Operation Warp Speed got going. You know, it's always, if you're a leader in business, if you're a CEO of a cabinet department, you know it's all about the people. People is policy. And you've gotten to see today some of the incredible people who have driven this to make this work and get these. I think, Paul, you had a really nice quote from Churchill. It's the people who allowed us to unlearn what was impossible. And folks like Dr. Moncef Slaoui leading on the development, General Gus Perna. When I talked to Secretary Esper and the chairman of the Joint Chiefs, they immediately said, oh, we got the guy for you. Had an Army Materiel Command and said, Gus is the guy for you. Got to be there. And I called around and I said, you know, I need manufacturing. And Carlo Di Natale Stefani, a real talent we don't mention as much, who led global manufacturing for all of Bristol-Myers Squibb, a biologic manufacturing company branded around the world, but also for Teva, one of the world's great generic companies, able to stand up 200 assembly lines and manufacturing processes per year. So that kind of talent, they dropped everything. These folks dropped everything that they were doing. General Perna moved, gave up his command, moved. These others volunteered. They gave up their retirements. They stopped their retirements. They came and they served the country just in the greatest spirit of what people did in World War II, what people did with the Manhattan Project, what people did with the Apollo Project. And I just want to express my public appreciation to the people who really are making this happen. And I want to also express my appreciation to the folks on the stage with me here. You know, under the Vice President's leadership, we have had an intimate and close connection to America's governors. Almost every single week, we have had a often multi-hour video conference with our nation's governors, our territorial governors, and it's really been one of the great collaborations I've ever seen. We are over 40 at this point, I know, of the gatherings that we have already had this year. And the 4 governors on the stage here, I don't think there's been a weekly session that the Vice President hasn't called on each of you to share your learnings, your understanding, and your expertise with your fellow governors. And there's a reason for that. As we talk, as Paul said, about the 3 key partnerships that are part of Operation Warp Speed, one of them is the federal-state partnership. And just on vaccine distribution planning, these 4 governors put together some of the best vaccine distribution plans, the real models for the rest of the country. And that's why we asked Governor Edwards, Governor DeSantis, Governor Abbott, Governor Lee to be here with us. But I just want to say, beyond vaccine planning, just throughout this entire pandemic, they've been incredible partners to work with on a bipartisan basis. It's been really an honor to work with each of you, so thank you for that. I want to kick things off. As I mentioned, there's a reason we asked you, in addition to your general expertise and leadership, but it was that the CDC looked at your plans and said your plans really are exceptional. Let me ask first, Governor Abbott, do you mind sharing with us any insights about the process you used to come up with your plan? And I'll turn to the other governors real quick just to get any insight there.
Sure. Well, first, thanks to you and thanks to everybody in the Trump administration for this Operation Warp Speed. It really is a feat of medical advancement. But as you know, we've been working collaboratively with you, with your team, and with the White House coronavirus team to get us prepared. So we began preparing for the delivery of these vaccines going all the way back to the spring. And we have accelerated that over the past month or two. And over the past month, we have already signed up more than 7,200 providers in the state of Texas that are awaiting for these vaccines as we speak right now, ready to make sure that we do put needles in arms within 24 to 48 hours as soon as we get those vaccines. The providers that are signed up include hospitals and private healthcare providers, nursing homes, local pharmacies, and these large pharmacy chains. Importantly, working with your entire team, learning the strategy and information that we need, we were able to set up a large number of these cold change storage operations so that we would make sure that we would be able to handle the Pfizer vaccine as well as the Moderna vaccine adequately. Also, to be ready for this, we understand when we're doing something this large, especially in a state the size of Texas, we needed to make sure that we were able to work out the kinks. And to do that, we actually ran several mock distributions in advance to make sure that when it does arrive, we will have eliminated any of the potential missteps. And then, very important, we have established ways that we are going to remain in communication with the people who receive the first vaccine. This includes when they do first receive their vaccine, they will be receiving a reminder card at that time, letting them know when they are to return, where they are to return, and the process about returning for the second vaccine. But we know that may not be enough. And so on top of that, we will be following up with text messages, with phone calls, with email reminders, and with a statewide communication plan to make sure there is an inescapable way for people to make sure that they're going to be learning about exactly what they need to do to make sure that they get that second dose to make sure that they are fully vaccinated.
Governor, one quick aside, you mentioned the vaccine reminder cards, and this is coming up a lot lately. We've talked about myths earlier today. That's not a national vaccine card, right? That's like when you go to the dentist and you get a reminder card saying, come back in 6 months and here's your appointment, right?
Well, and that's true. I'm going to take it a step further because of the unique attributes of Texas. There is no national vaccine card, we're not creating a national database or anything like that. But as Texans know, in the state of Texas, people cannot be required to take a vaccine. Most people want to, and there's going to be such a high demand for it that all of the supply will be used up. But I just want to make sure my fellow Texans know that we know that you are not going to be forced to take a vaccine against your will.
Great. Thanks, Governor. Governor Edwards, you mind telling us a little bit about how Louisiana and you came up with your game plan?
Yes, sir. So we got started in the spring as well, and I'll tell you that by June we created a vaccination action collaborative, and we have 73 members, 36 different organizations, public and private, higher education involved, and we created 4 work groups. They've been meeting every week since then. And every one of those work groups has a health equity interest that has been attached to it. The National Guard has been attached to it. And they've been working nonstop because we want to make sure that we have a way to do this that is equitable, but also we want to be organized in the way that we receive and distribute and actually administer these vaccines. And so we've involved LSU. They have the National Center for Biomedical Research and Training. They've run 2 tabletop exercises for us. Each one has been instructive because we realized we had some gaps that we needed to fill. We similarly had some distribution exercises to make sure that the hospitals, for example, would know what to expect, and hopefully in the next number of days they're going to actually be going through that. We've got a memorandum of agreement. The public-private partnerships are done at the state level too. So we have an exceptional pharmaceutical wholesaler in Louisiana's Shreveport area. We have a memorandum of agreement with them, and we've identified in advance all of these issues that we expect to have. And just like we've heard from Walgreens and CVS and UPS and FedEx and McKesson, states, we've been in the business of doing this for a long time too. So it's not anything new. It's just at a scale that we don't typically have to do it at, right? And so we have some really good professionals in the Office of Public Health in Louisiana working across the state with all these different groups. And we want to promote the confidence of the people of Louisiana that this is going to be a safe and effective vaccination that they're going to want to have. And so you've got to have a good plan in order to, I think, foster that confidence.
Thank you, Governor. Governor DeSantis?
Yeah, sure. Well, first of all, this is, I would always tell my folks, we hope we get a vaccine, but you should definitely not count on it because it's ambitious. It hasn't happened before. So the fact that it is, that's a great testament to Operation Warp Speed and all the work that so many people have done. So we couldn't, as soon as the Pfizer news came out, I flew up and met with you at Warp Speed, and I told my folks, we already been planning for it, but I was like, we got a better sense of the timeline. Let's make sure that we're leading from the front. We really wanted to embrace this. I know other governors have said this may not be good. We view it as a good thing, not forced for anybody, but offered to all. And we basically did our vaccine plan to flow out of our normal mitigation plan in terms of we focused on protecting vulnerable populations, whether it's in nursing homes or the broader senior population. We focused on supporting our healthcare system, and then we focused on making sure kids were in school, people were able to earn a living. And if you look at what we can do with nursing homes, we could have every resident of nursing home and long-term care facility vaccinated in the month of December. I mean, that's within our grasp right now in the United States. In the state of Florida, we have 4,000 facilities. We're working with CVS, Walgreens to be able to do that. It's important for saving lives because they're the most vulnerable, but most of them who get it do survive, and then many obviously have not been infected. But it has such a devastating effect to have mitigations going on in these. Look, we allow visitors, but you have to take all these precautions. You just can't live normally. And it's taking a huge toll on these folks. And so we see loneliness, despair, even with having some visitation. So we need to get them back to normal. And getting them back to normal is going to mean so much to those residents and their families, and I'm thrilled that we're really on the doorstep there. And then in terms of the healthcare system, look, the models that said that we're not going to have beds, tens of millions of hospitalizations, obviously those were very, very wrong. But what we found, particularly over the summer when we had a higher census, was it wasn't that we had plenty of beds, but you know, this is very labor intensive for healthcare staff with the isolation procedures, everything they've got to do. Obviously, they're testing everyone that comes in, so someone breaks their legs, they may be asymptomatic, but you still got to do the procedures. And then an exposure could take out a half a dozen nurses at one time. Well, to be able to get it through, offer it to our healthcare systems, their tip of the spear, high contact workers, to be able to have them, well, they're going to be in a situation where they're going to be able to handle a patient load going forward. And so I think in terms of the most at-risk population, we'll be able to target first, and then simultaneously the kind of the high contact, which would have the most impact on our healthcare system. And then we think, based on the numbers, at the end of December, we can start getting it out into the broader senior population, and then January really focus on vaccinating as many elderly people as we can. And so we're really excited about it. You know, we've really leaned into it, and then we thank everyone for doing it. This is a really, really significant achievement for our country.
Just imagine that every senior in a nursing home in Florida within the next several weeks getting protection. That is something. Wow. Well, Governor Lee, the Vice President, and Dr. Redfield and I came down to visit you and our great partners FedEx just last week. Do you mind telling us a bit about the great process you all used?
Yeah, we are proud of FedEx and the role that they're playing. Proud of Vanderbilt as well, the role that they're playing nationally in this process. So Tennessee is, we're excited to be on the forefront here. I want to commend your team too. Many of them that we have been on phone calls. You talked about the multiple phone calls we had. One of the benefits of that is the interaction that we've had with the governor. So many of the things that you're hearing right now, we're all doing in different ways. And part of the reason is because we've been talking about the things we're going to do because of the coordinated effort of the coronavirus task force. It's been a part of the reason why I think the approach from this administration has been so effective. It's allowed us to get best practices. But so Tennessee started several years ago with pandemic immunization preparedness by pulling up something we call Fight Flu TN. And we do once a year a broad immunization day across the state where we vaccinate thousands of people in every one of our 95 counties. And that process gave us a blueprint for how to do what it is that we're going to be doing in the next few weeks. Because our public health officials, because of the Fight Flu TN process, our public health officials had practice in the logistics of this and the communications of how it is that we get it out to folks. So we've taken that blueprint, recognizing that this is much bigger, pulled together stakeholders, groups that really advocate for Tennesseans, because we want to make sure this gets distributed equitably. And in order to do that, we brought in advocates for those with disabilities, AARP, our pharmacy companies, 30 different organizations to help us develop a priority population strategy that will include the most vulnerable in nursing homes, our healthcare providers and staff, for all the obvious reasons of making sure we have capacity in our healthcare system and protect the most vulnerable. And a lot of that strategy has come through the infrastructure that Tennessee built in the very beginning to address this, with a commitment to testing, free testing for every person in Tennessee, regardless of symptoms from the very beginning, a commitment to partnerships with our healthcare providers, and then a commitment to developing a real strategy for this vaccine implementation. So for a few years, we've been preparing for it. We have escalated that preparation this year. Really, again, federally, you all have done an unimaginable job of bringing this to the states. Now it's our turn to do what needs to be done to get it out to, in our case, the millions of Tennesseans that will have the choice to take this. We want to communicate it in a way that they are fully informed so they can make a choice, and that they understand the safety and the efficacy and the certainty with which we think this has been delivered.
Thank you, Governor. So next one, let's do rapid fire around here. I want to ask each of you, because it's a question I get on TV all the time, is on speed. Just how quickly do you think you can get 100,000 people vaccinated in your state? Governor Lee, you want to kick us off?
So the director of our health department, Dr. Lisa Piercy, is here. She probably could answer that, but I'm going to say, Dr. Piercy, that we can do it in 24 to 48 hours.
Wow. Governor Abbott?
Same thing. We're ready to go. All we need are the tests and the vaccines, and once we get them, they should be done within 24 to 48 hours.
Governor DeSantis?
Yeah, we hope so. I mean, I would need to ask for sure, but I think the hospitals, it was great because I talked to them, and they were like, look, this is easier than doing the diagnostic test. We do this all the time. We do shots. So I think they're going to be able to get their workforce done very quickly. And what we did was we picked certain number of hospitals that are huge, but we said, look, we want all the other systems. And so they're like, oh, absolutely. So they're all working together. And I think they're going to be able to deliver it, pretty expeditiously because they know. And the first shot, it has protection from what we're hearing. That's a huge deal, and that's really great.
Governor Edwards?
Well, assuming that we're on track with the emergency use authorization and so forth, we expect 39,000 doses of Pfizer the first week, about 40,000 the second week. So let me just tell you, within 48 hours of getting that second allocation, we will have administered those vaccinations with shots in the arm with medical personnel, not just doctors, nurses, and therapists, for sure them, but also people who clean the rooms, who deliver the food, anybody who directly or indirectly can be exposed to the virus and contract the disease in those hospital settings, including our EMS workers, by the way. So we're going to get it done within 48 hours.
And that last point Governor Edwards mentioned, I'd wanted to stress that a lot of times we use a term because we're in a healthcare world, we use a shorthand of healthcare providers. What we really mean are healthcare workers. And so as important as doctors and nurses, it's the janitors, it's the orderlies, it's the aides, everybody who are providing that kind of help that make the system in the hospital, the nursing home, what have you work, and are just as important, if not more often, than everybody else to make sure they get protection also.
Yes, sir, exactly.
Yeah. Along those lines, I wanted to raise the question of, we have, of course, advice out of the CDC and the Advisory Committee on Immunization Practices, but you all as governors have the freedom to decide how you'd like to prioritize. One of the key areas that I think we all worry about are the individuals who are underserved in our healthcare system, who may not have a lot of connection to it, may not have the frequency of interaction of others. As you've been thinking about your vaccine distribution plans, maybe Governor Edwards, if you might kick us off here, how are you thinking about reaching the more underserved in our community who, in many instances, have borne a very disproportionate burden of severe consequence from this pandemic?
Yeah, well, first of all, that's a great question. And we realized in April, by the way, that although African Americans are about 32% of our state's population, at that time 70% of COVID deaths were among African Americans. So I created a health equity task force that then folded on top of the vaccination action collaborative that I talked about. But we have a head start on these things because, like Governor Lee was talking about, every year we do mass vaccination exercises around the flu vaccine. And we specifically target those underserved areas to try to promote flu vaccinations. This year, we've been especially successful, 42% more than last year. And of course, part of that has to do with our outreach around COVID, too. We don't want flu patients any more than we want COVID patients in the hospital right now. And so that has been successful. So we've been learning lessons about how to get into these communities. But in addition to that, as part of our overall program, we have contracted with strike teams to go into specific zip codes. Just like we targeted certain areas that we knew needed to be tested, we're targeting certain areas that we know we're going to have to go in there with strike teams to administer these vaccinations. And so we have some that are commercial, but we also have stood up the National Guard. And by the way, I want to thank the administration for the extension of the Title 32 on the National Guard, because they're doing thousands of tests every day in Louisiana, but they're also a big part of our vaccination program with distribution and these strike teams that we're talking about. So with all of that, and I think we're going to get to this later, it's the underserved communities that we really need to do the most outreach to and communication with to build up the confidence in the safety and efficacy of the vaccines as well. And so that's a big part of reaching the underserved, because we don't just want the vaccine, we wanted the vaccination. And so that's what we're working on.
Dr. DeSantis?
Yeah, I think communication is important, and I know a lot of our hospitals are already planning on doing a lot of very robust outreach, but this was the first vaccine that's really been politicized, unfortunately. I mean, you guys remember the campaign, and that's going to be something that people are going to have to deal with, and we obviously want to deal with it. I think the fact that we're not threatening to mandate it helps, because we say, look, we think it's important, but obviously you make the decision. But and then I also think just some of the bad messaging that's come out over the course of this, quite frankly, is problematic. I mean, when people are doing some of these shutdowns that are totally unscientific about this type of activity, or being on a playground, or schools can't be open, then I think people look at that. So I hope we can kind of get on the same page here, take the politics out of it, be very consistent, be evidence-based on it, and I think people will respond positively.
Governor Abbott?
Sure. So part of the job is to first identify the location of the underserved communities. And in a state as large and diverse as the state of Texas, that's a daunting task, because some of the underserved community would be in our large urban areas. Some of it would be in the sparsely populated rural areas. Some of our rural areas, out of our 254 counties, there are some that don't have access to any medical health care whatsoever. And so we have to first identify them, then go to them. And the way that we are going to them is we have put together a bunch of mobile medical units that will be taking the vaccines to the people where they are in underserved communities, to make sure that they will have access to these vaccines also. And we'll be making clear exactly one thing that Governor Lee pointed out, and that is the importance that they know that these vaccines are free. It's not going to come with any money in your pocket, thanks in large part, or thanks in total part, to Operation Warp Speed and what y'all have done here. So thank you for doing that.
Thank you. Governor Lee?
We used our Office of Minority Health and Disparities Elimination. That is an office within our Department of Health, and we use that office to really advise us on testing, because what we found early on was that our minority populations, our ethnic populations, were not, the uptake in testing was not as it should be. So we tasked that group with really developing relationships to enhance our testing for those underserved populations. We utilized relationships with our housing development agencies in our urban centers, migrant working farming communities that are a part of the agricultural process in the state. We worked with African American churches, Hispanic churches. We utilized public service announcements on Spanish-speaking radio stations. So we worked really hard to make sure that those communities and those underserved populations were hearing from those that they trust about that testing population. That is the same group, now that we have developed those relationships, and we've been very grateful for, in particular, for example, the way the African American leadership has embraced Operation Warp Speed and has communicated that. Meharry Medical College, it's a nationally recognized HBCU that has worked with us to communicate with the African American community to talk about the safety of this vaccine, the importance of this population, and the uptake of the vaccine. So really it has been a continued effort from the first understanding that the barriers and the access to healthcare were eliminating or limiting the amount of testing. We used that knowledge. And by the way, frankly, one of the things we learned is it matters who delivers the message. Very powerfully matters who delivers the message. Not just to that community, but to every community across the state. So attaching the trusted voices in whatever community we're serving is going to be really important.
Great. Thank you very much. And Governor DeSantis, I know we're going to have to wrap soon because the Vice President's going to be arriving, but do you mind giving us the last word on how you're thinking about prioritization, how you're thinking about which groups you try to stack as we roll vaccines out?
Yeah, so I mean, obviously, we're prioritizing long-term care residents and staff, and then tip of the spear healthcare workers. As we get past that, which we think we can do with the first a couple weeks of doses that were allocated, get into the broader senior population. We have obviously a lot in that regard in Florida, so that would really take us in through the end of January. And then we're hoping the J&J comes online with the 1 dose. They're producing it at such a scale. Then we get that out so teachers can get it, law enforcement can get it, and really, I mean, hopefully we'd have enough for whoever wants to do it. So that's our hope. But the Moderna and the Pfizer, we think based on our allocations, we're going to be focusing that on high-risk populations and the frontline healthcare workers.
Well, I hope you've seen from this panel just how deeply engaged our nation's governors are in this process. The level of sophistication, understanding, depth of knowledge, amount of planning that they have done. I think every one of you said since the spring, since the spring, been planning on this. And these 4 governors, while some of the great governors, are representative of our nation's governors and the work that's going on in every state and territory. So we really appreciate their work and their partnership throughout this pandemic. And we look forward to the weeks ahead when you're going to be getting shots in arms. So thank you very much. Let's give a round of applause.
Thank you. Green light's on.
Green light? Yeah. So after you introduce him, the music is going to start, and then he's going to walk off. I need the seal.
Test 1 2 3 4 5 6 7 8 9 10. Mic check. Is he good?
Okay, thank you, Secretary Azar and our governors. As you can see, no one knows better what their communities will need than the folks who are closest to it. And General Pernin and I often share a phrase, and that is, you can never let your reach exceed your grasp. And I think the federal government understands where its reach ends and where its grasp ends, and where we have to hand things off to our governors, our mayors, and our county commissioners. As we said, before I introduce the Vice President, I think we started the session today by talking about 3 objectives. Maybe just take a moment to review those. One was to build a better understanding of how we're going to get safe and effective vaccines to the American people, anyone who's desiring one. I think the second one is build confidence that the Trump administration is following data and science in the evaluation and development of these vaccines. I think Peter Marks did a terrific job there. And then the third was, again, the recognized achievement, which is all of the private sector innovation, all the commitment, and the American spirit those working with the Trump administration have demonstrated every step of the way to help us get these vaccines out safely and effectively. I think I'm going to paraphrase Yogi Berra, believe it or not. I think he said, you can see a lot by watching. And as I introduce Vice President Pence, here's a guy who has tirelessly led the White House Coronavirus Task Force for the last 7 or 8 months. And you can see a lot by watching him. This is a multi-agency response. It's the Department of Defense, it's the Department of Health and Human Services, it's the Treasury Department, Secretary Mnuchin, the Labor Department, Department of Homeland Security. And this needed someone who could bring all those folks together and get them to collaborate, get them aligned, and the Vice President was great at that. He's also a former governor. And what you just heard Secretary Azar talk to the governors about, their role has been in our response and will be absolutely crucial to successful vaccine administration. And the guy is an optimist, and good leaders are optimists. We visited a plant up in Wisconsin when GE converted all of its lines to produce ventilators at record pace, unbelievable. And the Vice President just has a very, very special way of motivating folks in dark times, and he's done that for the last 7 or 8 months. But I told this story before, and I'll tell it once more. When I first met him about a year ago, I was in the West Wing, and anyone who spends time in the West Wing knows there's some extraordinarily bright, energetic, but extraordinarily young persons there. And I was in a room, and he walked up to me, and he whispered in my ear, he goes, "I'm glad there's someone else with gray hair in the room." So I'd like to introduce the other guy with gray hair to close out our summit, Vice President Mike Pence.
Well, thank you all very much. Paul, thank you for those kind words and for your tireless work at Health and Human Services. To Secretary Azar, really our host for the day, we thank you for your extraordinary leadership. And I think he deserves a round of applause. Secretary Alex Azar, we've been shoulder to shoulder for 10 months in all of this, and the President and I couldn't be more grateful. For the entire team at HHS and all the people that you've heard from today. Especially want to express my appreciation to Governor Abbott, Governor DeSantis, Governor Lee, and Governor Edwards. I hope in that panel that you just heard, you understood that that was just a sampling of a seamless partnership that we have forged with states across the country to put the health of America first. And governors, we're truly grateful. We're truly grateful. To other members of the Cabinet who are with us today, members of Congress, to mayors and state and local officials, especially health officials from around the country, thank you. Thank you for your role in bringing us to the precipice of a breakthrough in American medicine and in the life and health of the American people. We are literally days away from the fulfillment of the vision of Operation Warp Speed. And I want to thank you for participating. And I want to thank all of you who've looked on from afar to take in this vaccine summit. As you heard today over the last several hours, thanks to the leadership of President Donald Trump, the tireless efforts of health officials at the federal level and at the state level around the country, the ingenuity of great research companies, military personnel, our private sector partners, and the cooperation of the American people. We are literally, we believe in all likelihood, just a few days away from the approval and distribution of the first coronavirus vaccine in America. That is warp speed. From the first day, the President stood up the White House Coronavirus Task Force and asked us to lead it. And we had one mission, and that is to save American lives. And I believe the advance that we're about to fulfill and to begin to move out on will continue that mission apace and put us one day closer to the day we put the coronavirus in the past. But before I reflect on all that we've heard today and the extraordinary professionalism and cooperation that you've witnessed, I want to extend my sympathies to the families that may be looking on at this very hour, families that have lost loved ones over the course of this year. Even as we enter a time of great promise in this country, I want families that have lost loved ones and those that are still struggling in the midst of this pandemic to know there's not a day gone by that you haven't been on the hearts of all of us working at every level. And we will never forget your families or your loved ones as we hasten the day that we put this pandemic in the past. Now, because of the efforts of all of those that you've heard from today, and frankly, countless others, we literally are on track to distribute tens of millions of doses of the coronavirus vaccine before the end of this month. We're about to make history. And together, we're going to continue to save lives across this country. With the approval of first coronavirus vaccine, we believe is likely within days. As I said, we are one step closer to the day that, as a people, we will put this pandemic in the past. And as the President said from this very podium today, that America will continue to do our part to help families and peoples around the world. From the very beginning, I hope it is evident to all of you that President Trump's vision to our nation's response was not just a whole-of-government approach, but it's been a whole-of-America approach, meeting all of the challenges that we faced from early on. We reinvented testing. We saw the delivery of billions of medical supplies and equipment. We developed new medicines and therapeutics, and now just days away from the approval and distribution of millions of doses of this vaccine. I must tell you, having been working every single day over the last 10 months toward this objective, as an American, as your Vice President, as the head of the White House Coronavirus Task Force, I'm humbled and I'm very grateful for what the American people have accomplished. I'm grateful for the leadership of our President, the tireless efforts of all the health officials that have worked every step of the way. I'm grateful for the ingenuity of the great research companies all across this great nation and for the compassion of our people. After today's summit, I suspect more people than ever around the country will look at the progress that we are about to fulfill in Operation Warp Speed, and they will say, as I have said before, only in America. We are honored to have all of you to participate and all of you looking on to participate in this vaccine summit. The President wanted to convene this gathering to inform the American people of the progress that we've made in Operation Warp Speed, but also to give credit where credit is due. And Operation Warp Speed is a modern American miracle, but it's an accomplishment of all of the American people. It's amazing to think that the average development timeline for a vaccine can take 8 to 12 years. But as you heard today, we're on track to accomplish a safe and effective coronavirus vaccine in 8 to 12 months. Before Operation Warp Speed, the fastest prior vaccine development in the United States took over 4 years. But as the President said earlier today, we've developed a gold standard vaccine in just 9 months. Only in America. And the dates speak for themselves. January 10th, we received the first sequence of the coronavirus vaccine. Literally the next day, scientists went to work with private research companies and the National Institute of Health to begin to develop a vaccine. Within 6 weeks, which was also record time, we were already in phase 1 clinical trials. And with the support of many of the members of Congress that you saw here today, we were able to secure some $10 billion to develop a vaccine. But it would be in May of this year that the President launched Operation Warp Speed that you have heard in great detail today. The President said then that they were looking to get a vaccine by the end of the year, but in August, President Trump made a promise. He actually said, and I quote, "We will have a safe and effective vaccine this year." And here we are. The President's promise was met with considerable skepticism, not only in the scientific community, but across the public debate. But as we stand here today and we celebrate what we believe is the likely approval of 2 safe and effective coronavirus vaccines, the American people deserve to know that there are actually 4 vaccine candidates in large phase 3 clinical trials as we speak. Operation Warp Speed, we believe, is about to commence. It's about to save lives, and it will continue to expand to the benefit of the American people and the world. We're moving at record speed, but the American people can be confident that while we have cut red tape, we've cut no corners. And our standards for safety and effectiveness are just as rigorous as they have ever been. And the American people can be encouraged. Those that will have opportunities in this initial phase to take the vaccine can be confident.